One introduction RFK view the United States government was on track in the Biden administration to reduce the prices for both clean energy heat pumps and clean energy electric cars. Trump tariffs are expected to upset those plans to prevent future air pollution and prevent climate change. The United States government should, instead of certifying wood stoves as safe when they are not safe, go forward with regulations that ban wood stove use and direct government money for use of forest refuse only. For home building and furniture building, for just a few examples of use of forest products for non-burning uses, it is well known from scientific and medical research that wood burning is a substantial source of PM 2.5 emissions, yet the wood burning industry uses the scientifically debunked theory named carbon neutrality of wood burning to argue that wood burning replacing coal burning in industry, and in a trickle-down argument that wood burning should continue for home heating should continue. Presumably because it is called renewable, wood may be renewable in the sense that a tree can be planted in the place of a cut-down burned tree, but it takes centuries or decades for the newly planted tree to attain the stature of the cut-down burned tree. During those centuries or decades, photosynthesis, which converts CO2 to oxygen and so sequesters some carbon, will not take place at the same rate as photosynthesis was performed previously, and wood burning emits both CO2 and PM 2.5, and PM 2.5 is not absorbed by trees, so PM 2.5 is not diminished by planting a tree in the place of a cut-down and burned tree. In fact, a living tree closes its pores against the presence of PM 2.5 from nearby wood burning, just as humans hold their breath in the presence of PM 2.5 from nearby wood burning. And when a tree closes its pores, the level of photosynthesis that absorbs CO2 pollution goes down. Wood burning emits 90% PM 2.5 particulate matter of 2.5 micrometer size, the perfect size to infiltrate the human lungs, setting off a cascade of human health problems and early deaths. Contrary to many beliefs, wood burning emits 2.8 times the PM 2.5 as the fossil fuel coal burning, and wood burning emits 450 times the PM 2.5 as the fossil fuel natural gas burning. Replacing coal burning with wood burning creates more air pollution in the form of CO2 and PM 2.5 than coal burning. This emission data comes from testing the cleanest burning wood stove in the United Kingdom, the Eco-Design Wood Stove, and International Convention does not count the emissions from wood burning. The emissions from wood burning are erased from all countries around the world when calculating if each country has met its climate goals. This non-counting or erasure of wood burning emissions data from climate goals does not mean wood burning emissions do not exist. RFK view purple air PM 2.5 monitors hanging from the eaves of the house of a near neighbor should be used to measure the level of PM 2.5 in the air hyperlocally in the yards of near neighbors of indoor residential wood burners. If PM 2.5 levels exceed World Health Organization standards of 5 micrograms per cubic meter annually, then that evidence of air pollution from wood burning should lead to the shutdown of that indoor residential wood burning appliance, one appliance at a time if necessary.
Hi, my name is Lily. Andrew gave you the intro to residents against wood smoke emission particulates and their concern for air pollution from indoor residential wood burning. Residents against wood smoke emission particulates, or ROSEP, would like every near neighbor of an indoor residential wood burner whose wood smoke enters their yards and sickens the near neighbors to have a purple air PM 2.5 monitor hanging from the eaves of their home to measure the level of PM 2.5 entering their yards. That measurement of air pollution should be used as evidence of unnecessary air pollution, and each indoor residential wood burner should be shut down based on that evidence, one indoor residential wood burner at a time if necessary. The presentation by Andrew ended at 2 minutes 5 seconds. The same presentation by Emma starts at 2 minutes 3 seconds before the end of this podcast. So I am Lily, your timekeeper, and you can start the next podcast at 2 minutes 5 seconds in if you would not like to see the presentation by Andrew a second time. This presentation by me, Lily, ends at 5 minutes in. What you will see in the main content of this ROSEP podcast will be news about air pollution from indoor residential wood burning and how that air pollution is being combated by ordinary people just like you who are unfortunately near neighbors of indoor residential wood burners at this time. There will also be news about unnecessary and highly polluting use of wood as fuel in industrial wood burners and preventable air pollution from wood burning wildfires. There will also be news about air pollution from PM 2.5 from gas-powered cars. There will also be news about airborne diseases which are also preventable with vaccines such as COVID-19 and measles and whooping cough, to name just a few. In 2025, residents against wood smoke emission particulates is also concerned with combating the Trump destruction of government funding for programs which protect human health through the Department of Health and Human Services, and Trump destruction of programs which fund the science and medical research plan to protect human health from preventable illnesses. Protecting human health is a patriotic act, and our defense against enemies is weakened if we are not as healthy as we can be. Heat pump rebates are now offered by the federal government, distributed through the eligible United States, are available in 2025 and are the best, cleanest, and now cheapest alternative to indoor residential wood burning if that burning is actually done to purportedly save money. Wind and solar as sources of the electricity that powers heat pumps and electric cars is also cheaper than burning wood. The adverse health effects that are caused by indoor residential wood burning also come at a cost to near neighbors, both in shortening and ending their lives and in actual hospital, clinic, and funeral costs. Instead of being compensated monetarily, near neighbors should instead be able to achieve immediate relief by stopping indoor residential wood burning in their hyper-localized neighborhoods, which relief readings from purple air PM 2.5 monitors used as evidence of air pollution will help them achieve. Welcome to news about hopeful scientific and medical achievements that will also help us achieve the goal of clean air to breathe.
Webisode 57DHYAB December 5, 2025 Public health experts try to pre-bunk misinformation about vaccines ahead of CDC vaccine meetings. In Webisode 57DHYAB, one panel votes to end recommendation for hepatitis B shots for all newborns in a step toward the Health Secretary RFK Junior goal of a pending vaccine policy. The committee decided to delay the shots for babies of mothers who test negative for the virus, reversing long-standing guidance. Two CDC advisory panel votes to limit hepatitis B vaccines for newborns move from the RFK Junior advisors mirrors the Trump team. Regressive approach to long-standing vaccine guidance. Three public health experts try to pre-bunk misinformation about vaccines ahead of CDC vaccine meetings. For Alaska, Kipnuk, an Alaskan village confronts its changing climate. Rebuild or relocate. 5. Germany. After 1945, Germany constrained its army. Defense Minister Boris Pistorius trying to revive it. Boris Pistorius, the defense minister of Germany, is pushing to expand its military in case tensions with Russia escalate. That is tricky in a country where the Nazi era casts a long shadow. 6 and 7 headlines. Main content. One panel votes to end recommendation for hepatitis B shots for all newborns in a step toward the Health Secretary RFK Junior goal of a pending vaccine policy. The committee decided to delay the shots for babies of mothers who test negative for the virus, reversing long-standing guidance. Revive key excerpts. RFK Jr. and his associates have argued that hepatitis B is primarily a sexually transmitted disease and that babies do not need the protection unless their mothers are infected. Revive notes that from the other side of the argument, some outside experts were dismayed by the outcome, noting that unvaccinated infants would be at risk of being exposed to the virus at home or in other places they may share with infected people. Excerpts edited by Revive for brevity and clarity in relationship to residents against wood smoke emission particulates. A 501c3 nonprofit organization. The New York Times. December 5, 2025. The vote on Friday, December 5, 2025 was 8-3 in favor of limiting the hepatitis B vaccine for newborns. Revive chooses to reorder the article with all the arguments supported by the 3 CDC ASIP panel members who voted against limiting the hepatitis vaccine. First, Revive notes that Cody Meissner appeared to be the main spokesperson for the 3 who did not vote to limit hepatitis B vaccines for newborns. For many public health experts, the vote also marked the end of trust in the CDC and its vaccine advisors. Today is a defining moment for our country. Michael Osterholm, a public health expert at the University of Minnesota, said, "We can no longer trust federal health authorities when it comes to vaccines." In a statement, Dr. Richard Besser, president and chief executive of the Robert Wood Johnson Foundation and a former acting director of the CDC, said policymakers, physicians, and families must turn to reputable medical and public health groups for guidance, and health insurers should do the same for informing what vaccines they will cover. Some panelists noted that the practice had helped to nearly eliminate cases among newborns in the United States and that there was no evidence of harm from the shots. At any age, we know it is safe, and we know it is very effective. Dr. Cody Meissner, a professor of pediatrics at Dartmouth Geisel School of Medicine, said on Friday, and he warned that if the vote passed, we will see more children and adolescents and adults infected with hepatitis B. Supporters of the vaccine note that the virus can be spread by household objects like toothbrushes, razors, or combs that are used by an infected person. Only about half of cases before 1991 were a result of transmission from an infected mother. The CDC has recommended since 1991 that doctors administer the first dose of the hepatitis B vaccine within 12 hours of birth to infants whose mother is known to be infected, and within 24 hours for all other newborns. The first dose is given on its own, but 2 later doses are often administered as combination products containing vaccines for other diseases like diphtheria, tetanus, and polio. The vaccine panel does not typically make recommendations about antibody testing after vaccines are given. There was a vote by the committee on whether an antibody test could be given to see if after only 1 dose the vaccine was as effective as after 3 doses. 1 panelist abstained from that vote, and the result was 6-4 in favor of that antibody test recommendation after 1 vaccine dose. The committee had not heard any data on why 2 months had been chosen or on the feasibility or need for an antibody test, he said, adding, "This is unconscionable." Dr. Meissner also raised objections, saying the recommendation for an antibody test is kind of making things up, adding, "I mean, it is like Never Never Land." Some outside experts were dismayed by the outcome, noting that unvaccinated infants would be at risk of being exposed to the virus at home or in other places they may share with infected people. As many as 70% of the roughly 2 million Americans with hepatitis B are unaware of their diagnosis. Dr. Noelle Nelson, a hepatitis expert at Cornell Public Health and a senior author on the previous CDC guidelines for the vaccine, said the advisors did not follow the scientific evidence and risked undoing decades of progress in hepatitis B prevention, eroding vaccine confidence, and causing confusion among parents and healthcare providers. Dr. Robert Malone, vice chair of the panel who ran the meeting, said that the committee had invited Dr. Paul Offit and Dr. Peter Hotez, 2 prominent vaccine experts, to present at the meeting, but that both had declined. Dr. Offit, a pediatrician at the University of Pennsylvania, said the panel was offering misleading information to parents. "This is a political group, not a scientific group," he said in a message. "I do not want any part of that." Dr. Hotez, dean of the National School of Tropical Medicine at Baylor College of Medicine, echoed that sentiment. "I decline because ACIP seems to have shifted its mission away from science and evidence-based medicine," he said in a message referring to the vaccine committee. "I am always happy to discuss the science of vaccines with individuals or groups who are committed to truth and genuine intellectual inquiry." A majority of the public may be inclined to agree if the CDC and the American Medical Association were to offer conflicting advice, according to a survey released on Monday by the Annenberg Public Policy Center of the University of Pennsylvania. More than twice as many Americans would trust the medical organization over the premier public health agency of the nation. Now Revive lists the arguments of the 8 panel members who voted for limiting hepatitis B vaccines for newborns. The presenters at the meeting and at least some of the panelists are known for their views against vaccines and are close associates of RFK Jr. RFK Jr. and his associates have argued that hepatitis B is primarily a sexually transmitted disease and that babies do not need the protection unless their mothers are infected. The risk of infection throughout your early stage of life, and probably throughout most of your childhood, is extremely low. Redsef Levi, a panelist and a professor of operations management at Massachusetts of Technology, to quantify how low it is probably 1 in several millions. He said the panelist recommended that for infants born to mothers who test negative for the virus, parents decide whether and when to immunize their babies in consultation with their healthcare providers. Parents and their providers should consider vaccine benefits, vaccine risks and infection risks, and administer the shot no earlier than 2 months of age. The committee also voted 6-4 to recommend that parents seek out antibody tests to evaluate the effectiveness of the vaccine. RFK Jr. fired all 17 previous members of the vaccine panel in June, replacing them with people who largely share his skepticism about vaccines. At the meeting on Thursday, Cynthia Neveson, a climate researcher at the University of Colorado, and Mark Blaxell, a vaccine activist, presented data on disease rates and safety concerns about the vaccine. Dr. Neveson and Blaxell were 2 of 3 authors of a 2021 paper in the Journal of Autism and Developmental Disorders that purported to estimate the financial burden of rising autism cases. The journal later retracted the paper because of misrepresentation of the incidence of autism problems with the way the study was conducted and the undisclosed conflicts of interest of the authors. The third author of the paper, Toby Rogers, delivered a public comment at the meeting on Thursday, arguing that 2 widely used hepatitis B vaccines should have been licensed by the Food and Drug Administration. He did not disclose his close affiliation with Health Defense of Children, an organization against vaccines that RFK Jr. founded. Aaron Siri, a lawyer who for years joined with RFK Jr. in court battles over vaccines, is scheduled to present later on Friday about the childhood vaccination schedule. A federal vaccine committee decided on Friday to end the decades-long recommendation that all newborns be immunized at birth against hepatitis B, a highly infectious virus that leads to chronic liver disease in most infected children. The panel, called the Advisory Committee on Immunization Practices, or ACIP, voted 8-3 that women who test negative for the virus should consult with their healthcare provider and decide when or if their child will be vaccinated against the virus at birth. The committee did not change the recommendation that newborns be immunized if mothers are known to be infected or whose status is unknown. The shift is not expected to affect insurance coverage of the shots. More changes to vaccine policy are likely to follow in the next months as the committee goes on to review all childhood immunizations. 2 CDC advisory panel votes to limit hepatitis B vaccines for newborns. Move from the RFK Jr. advisors mirrors the Trump team regressive approach to long-standing vaccine guidance. Excerpts edited by Rozep for brevity and clarity in relationship to residents against wood smoke emission particulates. A 501c3 nonprofit organization, The Guardian, December 5, 2025. A photo of a woman holding up a sign at a protest of a key U.S. panel possibly voting to change the infant hepatitis B vaccine recommendation. The vote on Friday, December 5, 2025, was 8-3 in favor of limiting the hepatitis B vaccine for newborns. Rozep chooses to reorder the article with all the arguments supported by the 3 CDC ACIP panel members who voted against limiting the hepatitis vaccine. First, Rozep notes that Cody Meissner appeared to be the main spokesperson for the 3 who did not vote to limit hepatitis B vaccines for newborns. This vaccine limit will also have the effect of making the cost for the blood test after the first of 3 hepatitis B vaccine shots for newborns less likely to be covered by health insurance. The move will add confusion to routine vaccinations and create access issues, especially for lower-income families. Experts said this is going to lead to an increase in preventable infections among children, said the program director of prevention policy at the Hepatitis B Foundation. The vote is removing choice by causing barriers to access, and parents are not going to know who to trust any longer. She said, "We have heard do no harm is a moral imperative. We are doing harm by changing this wording," said Cody Meissner, professor of pediatrics at the Geisel School of Medicine at Dartmouth College, who is widely seen as the most experienced member of the committee and who strongly opposed the change, adding language around shared clinical decision-making creates barriers to care, said a practicing infectious disease physician and liaison at the meeting for the Association of State and Territorial Health Officials. Independent medical bodies, such as the American Academy of Pediatrics, strongly recommend that all infants receive the vaccine within 24 hours of birth. Delaying the shot from birth to 2 months would lead to at least 1,400 infections, 300 cases of liver cancer, and 480 deaths every year, according to a recent model. Liver cancer has an 18% 5-year survival rate in the United States. People holding a sign "It becomes my whole job." Autism advocates fight the RFK Jr. barrage of misinformation. In addition to this not being discussed, there has been no data presented that this plan would actually work, said an advisor and neurologist formerly at the National Institutes of Health. One of the votes is kind of making things up, Meissner said. "I mean, it is like Never Never Land. We are giving it to protect the infant against a potentially fatal disease." Meissner said, "We know it is safe and we know it is very effective, and to make the changes that are being proposed, we will see more children and adolescents and adults infected with hepatitis B." Now, Rozep lists the arguments of the 8 panel members who voted for limiting hepatitis B vaccines for newborns. The U.S. Centers for Disease Control and Prevention, CDC vaccine advisors, voted on Friday morning to limit hepatitis vaccines in a major move signaling the Trump regressive approach to vaccines that have been given safely and effectively for decades. The panel of advisors to the U.S. Health Secretary RFK Junior decided to remove the established and far-reaching recommendation that all newborns in the U.S. receive a hepatitis B vaccine. The committee voted to recommend that parents of infants whose mothers test negative for hepatitis should decide when or if their child should receive the vaccine series. After consulting a healthcare professional, hepatitis B vaccines are still recommended to children whose mothers test positive for the virus. The advisors said the shots for most infants at birth will now be shared clinical decision, making the advisors deciding voting 8-3, although this is a term that is poorly defined and usually reserved for vaccines which were not routine. Rozep viewed the committee also recommended a blood test after the first shot, although this subject is outside the scope of the CDC ACIP advisory body. The committee also discussed the possibility of 1 shot rather than 3 shots as advised in the past. Back to the article excerpt. The advisors also recommended giving blood tests to infants after they receive their first shot in order to determine whether additional shots are needed. It is an approach that has not been studied, and it is unclear if the blood test would reveal the levels of protection offered by the 3-shot course, recommending that providers perform a blood test and requiring insurers to cover the test is outside the scope of the vaccine advisory body. Meissner pushed back on claims by other advisors that hepatitis B vaccines are given to make up for mistakes of adults and flaws in our healthcare system, as Regressive Levi, an advisor and professor of operations management at the Massachusetts Institute of Technology MIT Sloan School of Management, said the recommendations will now go to Jim O'Neill, acting director of the CDC, who will weigh changing the U.S. official policy on hepatitis B vaccines. Three public health experts try to pre-bunk misinformation about vaccines ahead of CDC vaccine meetings. Excerpts edited by Rozep for brevity and clarity in relationship to Residents Against Wood Smoke Emission Particulates, a 501c3 nonprofit organization. KFF Health News, Friday, December 5, 2025. In this edition, KFF Health News original stories. 1. While scientists race to study spread of measles in U.S., Kennedy unravels hard-won gains. 2. Health savings accounts backed by GOP cover fancy saunas but not insurance premiums. 3. The GOP still cannot agree on a health plan. Vaccines. 4. Vaccine advisors balk at wording of proposed Hep B guidance. Delay vote administration news. 6. Democrats push for vote on 3-year extension of enhanced ACA subsidies. Reproductive health. 7. American Cancer Society okays self-swab screening for cervical cancer. Pharmaceuticals. 8. The Mark Cuban cost plus drugs. Humana may join forces to lower drug costs. State Watch. 9. New York health system may see cuts. Missed payroll without urgent aid. Weekend reading. 10. Longer looks interesting reads you might have missed. Editorials and opinions. 11. Viewpoints only. Science-led reform will loosen biosimilar barriers. How hypertension treatment is changing. From KFF Health News. KFF Health News original stories. 1. While scientists race to study spread of measles in U.S., Kennedy unravels hard-won gains. Scientists are conducting genetic analyses to see if the measles outbreak that started in Texas is still spreading from state to state. It is a contentious question because the findings may determine whether America loses its measles-free status. Amy Maxman, 1252. Health savings accounts backed by GOP cover fancy saunas but not insurance premiums. Health savings accounts can be used to cover medical expenses tax-free, but while wealthier Americans are using them to pay for gym equipment, cedar ice baths, and hemlock saunas, poorer Americans cannot use them to pay their skyrocketing health insurance premiums. Amanda cites 1253. What the hell? From KFF Health News. The GOP still cannot agree on a health plan. Senate Democrats were promised a vote by the middle of December on extending Enhanced Affordable Care Act subsidies, but Republicans still cannot decide whether they want to put forward their own alternative or what that might include. Meanwhile, the CDC and FDA are roiled by debates over vaccines. 12.4 summaries of the news. Vaccines for vaccine advisors balk at wording of proposed Hep B guidance. Delay vote. Advisory Committee on Immunization Practices panelists are taking a closer look at the recommendation, which was revised 3 times just before the meeting. They could vote today on whether newborns should get the shot, plus the ACIP trustworthiness is under the scope. SIDRAP. During chaotic meeting, CDC advisors handpicked by RFK Junior postponed vote on changing hepatitis B vaccine recommendations during a contentious meeting dominated by racial innuendo and talking points against vaccines. Advisors to the Centers for Disease Control and Prevention CDC today voted to delay a decision on whether to recommend scaling back infant vaccinations for hepatitis B, a virus that kills 1.1 million people around the world each year. Several members of the Advisory Committee on Immunization Practices ACIP asked for the postponement after complaining that they had not been given sufficient time to consider the wording of the proposal. Sabo Van Buscom and Dahl 12 for the Hill. Bill Cassidy calls ACIP totally discredited ahead of vaccine guidance votes. Senator Bill Cassidy, Republican of Louisiana, on Thursday called a federal Vaccine Advisory Committee totally discredited ahead of a vote on whether to change hepatitis B vaccine guidelines, an issue very close to the Louisiana physician. The Advisory Committee on Immunization Practices ACIP for the Centers for Disease Control and Prevention CDC is scheduled to vote on a recommendation to no longer advise birth doses of the hepatitis B vaccine for mothers who are negative for the virus or do not know their status, instead recommending an individual-based decision. Making approach. Choi 12 for SIDRAP. Public health experts try to pre-bunk misinformation about vaccines ahead of CDC vaccine meetings. The Centers for Disease Control and Prevention CDC Vaccine Advisory Committee, which helps determine the official immunization recommendations of the CDC, was once admired around the world for its evidence-based deliberative review of medical science, but public health experts yesterday warned people not to trust the Advisory Committee on Immunization Practices. ACP. Sabo 12 for Politico. RFK Junior, ally anti-vaccine lawyer, to brief CDC vaccine meeting on Friday. The CDC Vaccine Advisory Panel decision to invite a lawyer against vaccines, an ally of Health Secretary RFK Junior, to brief the panel on Friday, is drawing blowback from the RFK Junior top Republican critic on Capitol Hill. Aaron Siri, a vaccine injury lawyer who has advised and represented RFK Jr., is scheduled to present on the childhood immunization schedule at the CDC Advisory Committee on Immunization Practices meeting in Atlanta. Gardner 12 or also SIDRAP poll shows Americans trust AMA over CDC when it comes to vaccines. Americans are more likely to accept guidance on vaccines from the American Medical Association AMA than from the Centers for Disease Control and Prevention CDC, though trust is not particularly high for either organization, according to an Annenberg Public Policy Center poll released yesterday. Sushere 12 for SIDRAP. Fewer people are being vaccinated against respiratory diseases. Although the 2025 flu season could be challenging, fewer adults have been vaccinated against influenza. A new study shows much less than half of U.S. adults have been immunized against any respiratory virus, according to a survey of 1,015 adults released this week by the National Foundation for Infectious Diseases. NFID, just 34% of adults have gotten a flu shot, 25% have had a COVID-19 shot, 8% have received a vaccine to prevent pneumococcal disease, and 6% have been vaccinated against respiratory syncytial RSV SABO. 12.5 KFF Health News. While scientists race to study spread of measles in U.S., Kennedy unravels hard-won gains. The United States is poised to lose its measles-free status next year. If that happens, the country will enter an era in which outbreaks are common again. More children would be hospitalized because of this preventable disease. Some would lose their hearing, some would die. Measles is also expensive. A new study, not yet published in a scientific journal, estimates that the public health response to outbreaks with only a couple of cases costs about $244,000 maximum. 12.5 on COVID vaccines. MedPage today. COVID shots tied to a lower risk of death from any cause. Young and middle-aged adults who had at least one dose of a COVID-19 mRNA vaccine were less likely to die of any cause in the following 4 years compared with those who were not vaccinated. A nationwide French cohort study found RUD-12 for administration. News. More news about federal funding. Status lab was humming with discovery after 1 year under Trump. It is almost silent. The offices at the John Quackenbush Lab at the Harvard T.H. Chan School of Public Health were once full of postdoctoral fellows, graduate students, and interns. Young scientists here worked on some of the most cutting-edge computational biology research in the world, driving new discoveries and the creation of widely used big data tools, including one the National Cancer Institute named among the most important advances of 2024. Today, the offices are rows of empty computer pods. Monitor brackets at each station hang in the air, as bare as bleached corals. Chin 12. 5 Capitol Watch. 6 Democrats push for vote on 3-year extension of enhanced ACA subsidies. A vote for a straightforward 3-year extension of the Affordable Care Act subsidies is expected in the Senate next week. Senate Democratic leader Chuck Schumer announced Thursday the GOP still has not settled on an alternate plan to Hill Democrats to force Senate vote on 3-year extension of health insurance subsidies. Senate Democratic leader Chuck Schumer, Democrat of New York, announced Thursday that Democrats will force Republican senators to vote next week on a 3-year extension of enhanced health insurance premium subsidies that are due to expire in January. Senate Majority Leader John Thune, Republican of South Dakota, controls the Senate floor schedule, but promised to let Democrats have a vote on a proposal to extend the health insurance subsidies as part of a deal with centrist Democrats to reopen the federal government after a 43-day shutdown. Bolton 12 for KFF Health News. KFF Health News. What the health? The GOP still cannot agree on a health plan. The Senate is scheduled to vote in the coming days on a Democrat-led plan to extend the temporary additional subsidies that have lowered out-of-pocket costs for Affordable Care Act health plans. But even with the vote approaching, Republicans in the House and Senate are divided over what, if any, alternative plan they should offer. Meanwhile, anti-vaccine forces at the Centers for Disease Control and Prevention and the Food and Drug Administration have both agencies in disarray. Rovner 12 for more about ACA subsidies. Cranes Detroit business. ACA premium spikes have Blue Cross call center volumes exploding as Congress mulls whether to extend enhanced health insurance subsidies. Desperation is growing for Michigan enrollees. The Marketplace call center for Blue Cross Blue Shield of Michigan, the largest public health exchange insurer in Michigan, has experienced a 20% spike in calls from members and potential members over exorbitant price increases set to take effect in 2026. Walsh 12 for To the Hill. Most Americans back extending Obamacare subsidy. Survey finds a majority of Americans want Congress to extend subsidies on Obamacare set to expire at the end of the year, according to a survey from the health nonprofit KFF released Thursday of those enrolled in Obamacare. Marketplace plans. KFF found that 84% want Congress to extend the credits these subsidies allow Affordable Care Act ACA enrollees to pay less than the full price of their health insurance premiums, which would balloon if the tax credits expire. Mancini 12 for ABC News. 1 in 4 Affordable Care Act enrollees would have to very likely forego health insurance if premiums double. Poll 1 in 4 Americans covered by the Affordable Care Act ACA are considering going without health insurance if their monthly premiums double next year. A new KFF poll published Thursday finds open enrollment for the ACA began last month, and many Americans experienced sticker shock upon receiving their annual notices and discovering their 2026 premiums would be increasing. Kacados 12 for KFF Health News. Health savings accounts backed by GOP cover fancy saunas, but not insurance premiums. With the tax-free money in a health savings account, a person can pay for eyeglasses or medical exams as well as a $1,700 baby bassinet or a $300 online parenting workshop. Those same dollars cannot be used, though, to pay for most baby formulas, toothbrushes, or insurance premiums. Cites 12.5 and other news from Capitol Hill. Modern healthcare lobbying surge in 2025, led by PHRMAHA. It has mostly been a bad year on Capitol Hill for the healthcare sector, but it has been a good year for healthcare lobbyists. Healthcare lobbying expenditures spiked 16% to $653 million during the first 3 quarters of 2025, compared with the same period a year before, according to a modern healthcare analysis of data compiled by Open Secrets, which tracks campaign finance and lobbying spending. McAuliffe 12 for reproductive health. 7 American Cancer Society OK self-swab screening for cervical cancer. The updated recommendations were released Thursday and include new guidance on when women can stop being screened for cervical cancer. In other news, a new Texas law allows residents to sue those suspected of making, distributing, or mailing abortion pills in or out of the state. The Washington Post cervical cancer screening guidelines just changed here is what it means. The American Cancer Society has endorsed vaginal samples collected by oneself for cervical cancer screening, a change medical experts say will help expand access and improve detection. The updated ACS recommendations released Thursday reflect advancements in disease detection and access to screening options in the United States. CHIU 12.4 for Alaska. Kipnuk, an Alaskan village, confronts its changing climate. Rebuild or relocate. After a devastating storm, the people who fled a remote coastal village face an existential question. A 64-year-old grandmother in her hotel room in Anchorage after her home was destroyed by typhoon. How long? Excerpts edited by Rozep for brevity and clarity in relationship to residents against wood smoke emission particulates. A 501c3 nonprofit organization. The New York Times, December 5, 2025 in a hotel on the outskirts of Anchorage, a woman and her daughter struggle to envision the future. A little more than a month ago, the women were evacuated along with about 1,000 others from Kipnuk, their remote coastal village in western Alaska that was destroyed by the remnants of a typhoon. They were airlifted to safety. There are no roads to their community. Many landed in hotels about 500 miles away in Anchorage, which might as well be a different planet for all the ways the city differs from their tight-knit rural community. It is here the two women are wrestling with the kind of uncertainty facing more communities as the planet warms. The 64-year-old woman wants to return to Kipnuk and the way life used to be, however long it takes to put the decimated village back together. She said, "I will wait." The 38-year-old woman thinks the only safe option for the community is to move to higher ground. Somewhere more protected. The land is sinking, she said, referring to the permafrost upon which the village was built, and that is now buckling as rising temperatures cause it to thaw. It is not how it used to be. The thought of returning to Kipnuk scares the 15-year-old daughter of the year-old woman. Like the other village children, the 15-year-old has enrolled in a new school in Anchorage, much bigger than the one in Kipnuk. It provides some normality and routine for the children, many of whom ended up in a school with a Yupik language immersion program, but also challenges. One recent day, she stayed at the hotel instead of going to school, saying she did not feel well. She scrolled on her phone on the bed next to her grandmother, who was searching YouTube for Chris Christopherson music and knitting a bright yellow phone case. She was thinking about Kipnuk. "I am not going back," she whispered, adding that she would only feel safe on higher ground. Their hotel in Anchorage sits next to a small airport where jets land and take off each day. Sometimes the sight of one excites her little 3-year-old brother because he knows it is the type of plane that typically ferries people to Kipnuk. His grandmother said, "He asked me if we can go home," his mother said. Germany. After 1945, Germany constrained its army. Defense Minister Boris Pistorius trying to revive it. Boris Pistorius, the defense minister of Germany, is pushing to expand its military in case tensions with Russia escalate. That is tricky in a country where the Nazi era casts a long shadow. Excerpts edited by Rozep for brevity and clarity in relationship to residents against wood smoke emission particulates. A 501c3 nonprofit organization, the New York Times. December 5, 2025. Ever since Germany reformed its military after World War II, the primary role of the German defense minister has been to maintain an army large enough to protect the country, but constrained enough to prevent a return to German militarism. The role of the incumbent Boris Pistorius is different, as Russia warns that it is ready for war with Europe. The Pistorius goal is to make the military of Germany capable of leading the defense of the European continent in a major land conflict, and to prepare the pacifist population of Germany for this new posture. On Friday, German lawmakers approved the latest part of the Pistorius plan, a law that aims to increase the number of German soldiers to 260,000 by 2035, and nearly 50% boost to incentivize recruitment. Soldiers will be paid more and receive more training that is useful for civilian careers. All 18-year-old men will be sent a questionnaire requiring them to provide information about their health and fitness, making it easier to identify potential recruits. Women will be able to fill the form out voluntarily. The law, which had set off one of the most turbulent national debates in recent memory, stopped short of actually drafting soldiers. That is a mistake, according to some experts who fear Germany will not be ready for a Russian attack on NATO territory, even if the law requires Parliament to discuss reintroducing conscription if too few people volunteer for duty. The supporters of Pistorius said it was the best he could do given a deep-seated unease about rearming the country that started World War II. This is one of the biggest social changes we have seen in many years in the areas of security and defense, Pistorius, aged 65, said in an interview. It affects a generation and future generations who have never had to deal with these issues because the threat did not exist, he added. The law is the latest in a sequence of moves that were unthinkable less than a decade ago, but that Pistorius has promoted in order to bolster German defense. In March, he helped lead a successful effort to remove limits on military spending from the Constitution of Germany. That was a major shift for a debt-shy country, and it enabled Pistorius to spend billions more on arms, tanks, ships, and aircraft that the country previously could not buy. Pistorius has also championed a stuttering effort to integrate the militaries of Europe. He was a guiding force behind the recent formation of the Group of Five, a bloc of defense ministers from major European countries who seek tighter security coordination. For some, such moves provoke unease, summoning memories of German expansionism during the two world wars. 6 headlines. The New York Times, December 4, 2025. Alaska. An Alaskan village confronts its changing climate. Rebuild or relocate. The New York Times. Europe. Trump administration says Europe faces civilizational erasure. The New York Times. Germany and Russia wary of Russia. German Defense Minister Pistorius is growing his army. The New York Times. Housing. Climate change opinion. Buying a house, you should be able to know its climate risk. The New York Times. India. Aviation. The Indigo airline of India falls into chaos, canceling about 1,000 flights. The New York Times. India and Russia. Putin basks in praise for Modi on India visit. The New York Times. Musk. European Union. EU hits the X of Elon Musk with $140 million fine. The New York Times. New York City. Artificial intelligence. New York Times sues AI startup Perplexity over use of copyrighted work. The New York Times. New York City election of Mamdani. Rich New Yorkers are again threatening to leave. Here is why they do not. The New York Times. Recipe shrimp cocktail, salad recipes, simple party appetizer recipes, NYT. Cooking Republicans. The GOP continues to slip. The New York Times. Scotland. Aviation air traffic control issued briefly grounds flights at Edinburgh Airport. The New York Times. Trump affordability. Opinion. Avocado prices keep going up. Blame narco inflation. The New York Times. Trump affordability. The Trump approval rating dips as views of his handling of the economy sour. The New York Times. Trump lack of affordability. PCE report shows consumer prices rose slightly in September. The New York Times. Trump Supreme Court. Texas Supreme Court clears way for Texas redistricting maps pushed by Trump. The New York Times. Trump Supreme Court support opinion. Actually, the Supreme Court has a plan. The New York Times. TV. Jimmy Kimmel thanks Trump for Google superstardom. In 2025, the New York Times. Venezuela opinion. The Trump vote strikes corrode the soul of America. The New York Times. 7 headlines. The Guardian. December 5, 2025. Air pollution from charcoal burning. Rozep. View. AI overview. Charcoal is not a fossil fuel unlike coal, which is a naturally occurring fossil fuel formed from the remains of plants and animals over millions of years. Charcoal is produced by the combustion of carbonaceous materials, such as wood, in a low-oxygen environment. Therefore, while both contain carbon, their origins and formation processes are fundamentally different. PM 2.5 from charcoal burning is indeed harmful and can have similar health impacts as PM 2.5 from coal burning. Both sources of PM 2.5 are associated with serious health risks, including respiratory issues and increased mortality rates. From the article headline Maximum Protein Minimal Carbs, Why Gym Bros Are Flocking to Charcoal Chicken Shops in Australia. Australian food and drink. The Guardian. Europe far right and Trump allied cultivate resistance policy paper lays bare Trump support for the far right of Europe. U.S. foreign policy. The Guardian. RFK Junior lack of knowledge of science and medicine. CDC advisory panel votes to limit hepatitis B vaccines for newborns. Trump administration. The Guardian. RFK Junior lack of knowledge of science and medicine. Digested weak book lauds the RFK Junior chest ridicule ensues. Emma Brox. The Guardian. Spain far right allied with United States. U.S. leader of global neo-Nazi terrorist group signals retribution for arrests. Far right U.S. The Guardian. Trump ballroom. Trump replaces architect overseeing $300 million gilded ballroom project. Donald Trump. The Guardian. Venezuela. Stephen Colbert on the Pete Hegseth Venezuela scandal frantically pointing the finger. Late night TV roundup. The Guardian. Venezuela. 2 hours U.S. airstrike survivors clung to boat wreckage for an hour before second deadly attack video shows U.S. military. The Guardian.
Red Green Fox here. The quick red green fox jumped over the barriers to clean air. Red Green Fox here. Ready to sing to you the names of the 2025 major wood-burning biomass industry subsidy opponents. 1. Biofuel Watch. 2. Bulkley Valley Stewardship Coalition of British Columbia, Canada. 3. Comite Schoen Lucht, which means Beautiful Air Committee in German. 4. Dogwood Alliance. 5. Equity Group Foundation, nicknamed EGF. 6. Environmental Paper Network, nicknamed EPN. 7. Natural Resources Defense Council, nicknamed NRDC. 8. Prakaunia Narzek Wissenskip Istet, which means Workshop for All Beings in Polish. 9. Rachel Carson Council. 10. Solutions for Our Climate, nicknamed SFOC.
Cat's corner strategy with Tiger and Leone. Saying the quiet part out loud. Roar. Hi, I am Tiger. Our human asked us to get up from our naps and start Cat's corner strategy with Tiger and Leone. She gave us a list of internet allies which we will post for her here.
Hi, I am Leone. It is better for your mental fitness to go to these websites than to go to bro sites for advice. Substack letters from an American Heather Cox Richardson. Substack your local epidemiologist. The Midas Touch. The Guardian. The New York Times.
One introduction. Rosette view. The United States government was on track in the Biden administration to reduce the prices for both clean energy heat pumps and clean energy electric cars. Trump tariffs are expected to upset those plans to prevent future air pollution and prevent climate change. The United States government should, instead of certifying wood stoves as safe when they are not safe, go forward with regulations that ban wood stove use and direct government money for use of forest refuse only for home building and furniture building. For just a few examples of use of forest products for non-burning uses, it is well known from scientific and medical research that wood burning is a substantial source of PM 2.5 emissions, yet the wood burning industry uses the scientifically debunked theory named carbon neutrality of wood burning to argue that wood burning replacing coal burning in industry, and in a trickle-down argument that wood burning should continue for home heating should continue. Presumably because it is called renewable, wood may be renewable in the sense that a tree can be planted in the place of a cut-down burned tree, but it takes centuries or decades for the newly planted tree to attain the stature of the cut-down burned tree. During those centuries or decades, photosynthesis, which converts CO2 to oxygen, and so sequesters some carbon, will not take place at the same rate as photosynthesis was performed previously, and wood burning emits both CO2 and PM 2.5, and PM 2.5 is not absorbed by trees, so PM 2.5 is not diminished by planting a tree in the place of a cut-down and burned tree. In fact, a living tree closes its pores against the presence of PM 2.5 from nearby wood burning, just as humans hold their breath in the presence of PM 2.5 from nearby wood burning. And when a tree closes its pores, the level of photosynthesis that absorbs CO2 pollution goes down. Wood burning emits 90% PM 2.5 particulate matter of 2.5 micrometer size, the perfect size to infiltrate the human lung, setting off a cascade of human health problems and early deaths. Contrary to many beliefs, wood burning emits 2.8 times the PM 2.5 as the fossil fuel coal burning, and wood burning emits 450 times the PM 2.5 as the fossil fuel natural gas burning. Replacing coal burning with wood burning creates more air pollution in the form of CO2 and PM 2.5 than coal burning. This emission data comes from testing the cleanest burning wood stove in the United Kingdom, the Eco-Design Wood Stove. International Convention does not count the emissions from wood burning. The emissions from wood burning are erased from all countries around the world when calculating if each country has met its climate goals. This non-counting or erasure of wood burning emissions data from climate goals does not mean wood burning emissions do not exist. Rosette view. Purple air. PM 2.5 monitors hanging from the eaves of the house of a near neighbor should be used to measure the level of PM 2.5 in the air hyperlocally in the yards of near neighbors of indoor residential wood burners. If PM 2.5 levels exceed World Health Organization standards of 5 micrograms per cubic meter annually, then that evidence of air pollution from wood burning should lead to the shutdown of that indoor residential wood burning appliance, one appliance at a time if necessary.